Dr. Susan Monarez has been officially confirmed by the Senate to lead the CDC. She was acting as the interim director since, I believe, since January, since Trump got inaugurated. Anyways, the question is this actually someone who has the credentials to do the job? Are they actually qualified? Because especially under this Health and Human Services umbrella, it's a bunch of it's a lot of unqualified people, a bunch of anti-vax people. Like, RFK has no business being in the position he is. Anyways, I digress. We're going to read this article from CNN about the confirmation, and then we're going to bring in our favorite MAGA consultant, ChatGPT. It's been a while since we brought them in to get some additional information on Miss Dr. Susan Monarez. Anyways, Dr. Susan Monarez was confirmed to lead the U.S. Centers for Disease Control and Prevention on Tuesday in a 52 to 47 Senate vote. Monarez, a microbiologist and infectious disease expert who has served across several federal health agencies over the years, was the CDC's deputy director from January to March. She was nominated to lead the agency after President Donald Trump withdrew his first nominee, former Florida Rep. Dave Weldon. White House officials had privately voiced concerns about Weldon's comments expressing skepticism about vaccines. This year is the first time the CDC director post has required Senate confirmation. Previous directors were appointed to lead the agency. She brings decades of distinguished experience in health innovation, disaster preparedness, global health, and biosecurity, the CDC said Tuesday in a post on social media. Dr. Monarez will lead at CDC Gov's efforts to prevent disease control and respond to domestic and global health threats, advancing good old RFK's mission to make America healthy again. And, they're doing stuff in order to facilitate that. They're doing stuff like, just eliminating food and safety inspections, water testing, just stuff like that. Real Maha stuff. Anyways, during her confirmation hearing last month, Monarez distanced herself from some Trump administration directives such as mass layoffs at the CDC and proposals to eliminate programs. Some of her comments appeared to put her at odds with U.S. Health and Human Services Secretary Robert F. Kennedy Jr. on the issues such as the benefits of vaccination and the fluoridation of public water, supplies, although she was vague about the future of those programs under her leadership. Members of the Senate Health, Education, Labor, and Pensions Committee has sought reassurances during the hearing that Monarez would protect the integrity of the CDC's Advisory Committee on Immunization Practices, a panel of independent experts who advise the agency on issues such as vaccination. Kennedy dismissed all 17 of its members last month, citing conflicts of interest, and replaced them with 8 new members, several of whom had records of criticizing vaccine safety. Yes, real Maha stuff. Dr. Monarez is stepping into one of the most consequential public health roles in the world at a moment of profound challenge for the CDC. Dr. Richard Besser, president of the Robert Wood Johnson Foundation and a former acting CDC director, said in a statement Tuesday, "Every American benefits when CDC has the resources it needs to advance its mission to protect health, yet the Trump administration has engaged in unprecedented attack on CDC's mission, budget, and personnel. Dr. Monarez must not only lead the CDC, she must fight for it. Our nation's entire public health system depends on CDC having the tools it needs to respond to pandemics, reduce chronic disease, and address health and inequities that continue to leave too many communities behind. That starts with a director willing to speak the truth, defend science, and stand up for the health of every American." We'll see about that. We'll see about that. Anyways, the CDC's already been ravaged, before she's even officially stepping in, because they cut during the Doge cuts. I believe a bunch of CDC staff was cut. Obviously, pulling out of WHO, the World Health Organization, is devastating because you lose access to so much information about, what other countries are learning about diseases, what other outbreaks are going on, and just staying up to date. And yeah, that you're already in an uphill battle if she's even willing to fight that battle. Okay. Anyways, I asked our good friend, MAGA consultant, ChatGPT, what are the criticisms of Dr. Susan Monarez, and are they valid? I feel like I'm saying her name different as the video goes on. um, Here's a clear, up-to-date breakdown of the main criticisms leveled at Dr. Susan Monarez and how they hold up. Key criticisms: avoiding direct opposition to RFK Jr.'s vaccine policy. During her Senate confirmation hearing, Monarez affirmed her support for vaccines as life-saving and denied any causal link between vaccines and autism. So that's fine. If she really emphasized like life saving, that's a bit questionable, because at that point you're starting to get into like, well, I consider this life saving, but I don't consider the COVID vaccine life saving. You see where I'm going here? However, she largely sidestepped questions about whether she disagreed with the Human Health and Human Services Secretary Robert F. Kennedy Jr.'s controversial decisions, especially the firing and replacement of the Vaccine Advisory Committee with vaccine skeptics and agency staffing cuts. Complicity in agent cuts and dismantling programs. As acting director, she repeatedly said she wasn't directly involved in decisions to cut staff or eliminate CDC programs, but did not strongly push back, a stance questioned by senators like Tim Kaine and our GOAT Bernard Sanders. So, yeah, this is like where it's starting to get like you don't seem to be much of like a person who's gonna stand up to what the Trump administration wants to do. So lack of medical degree, I completely disagree with this one. So unlike previous CDC directors, Monarez holds a PhD in microbiology and immunology, not in like a doctorate or like, like an MD, a medical doctorate or whatever the fuck it is. Critics argue this makes her less attuned to medical contexts. Supporters counter that her systemic science policy engineer background is fitting for agency leadership in the current climate. From strictly like credential wise, like this education, microbiology and immunology is I'm bad at English, okay? That sounds pretty good, and it's almost like a different approach to directing the CDC. Like if she was actually acting at her own will, that would be a very interesting take. Now, I am not an expert in this, and I'm not going to claim that I know the inner workings of the CDC, so I could be completely just off here, but that sounds like an interesting experience and background to take to the CDC. So, are the criticisms valid? Sidestepping RFK Jr.'s stuff. So she did not explicitly oppose controversial policy shifts. So it sounds like she's kind of just playing the game. Like, obviously, if she wants to keep the nomination and not get instantly canned, she has to kind of dance around that. And that's going to lead to my final point that we'll touch here on at the end. So, context and mitigating factors. She's a career scientist and innovator with deep experience in federal health innovation, biosecurity, and coordination. Leadership roles at ARPA-H, OSTP, DHS. Monarez brings a system-level perspective praised by experts like Dr. Michael Mina. Support for science-based policy. She currently affirmed vaccine safety, including mRNA platforms. That's good. Very good if that's the case, and pledged to improve agency accountability and outbreak preparedness. That's just basic talk. Like, Dr. Oz says he's gonna make the Medicaid or Medicare or whatever. He's gonna make that more accountable and better, and so this is just standard talk, nothing to take away from that, because obviously they're not going to come out and be like, yeah, I'm going to make it worse. You know what I'm saying? Political realities. Her reticence may reflect pragmatic navigation of agency politics, given RFK Jr.'s position as her boss and broader shifts at HHS. Kind of what I was alluding to earlier, trying to strategically navigate Bottom line, main criticisms, especially about avoiding confrontation with RFK Jr.'s policy and being a non-physician director, are grounded in her hearing testimony and public record. Again, I kind of like the educational background a lot. But they don't fully undermine her qualifications. She brings substantive public health and systems leadership experiences. My final thoughts are like on paper. I mean, granted, I take everything I say with a grain of salt because I did not do an extremely deep dive into her. But from everything I'm reading, as far as actual, like, if we're talking strictly background, experience, and education, I think she is might be one of the rare nominations that's actually qualified for the position. If you think otherwise, let me know. But let's get to what actually matters. Is this someone who is of independent thought and independent will? Because at this point, if you're being nominated for any position, you're a yes man, you're a yes woman, and that's what I am gonna assume that she is gonna be, especially while she was like acting deputy director or whatnot. She admitted she didn't do any pushbacks, but she didn't take any part. So, like, as far as protecting the agency from further cuts or even advocating to expand it or anything like that to make any actual innovative radical change, I just don't see it. I think she's going to be largely beholden to what Donald Trump and RFK Jr. want to implement. Like, I, I, I think that is more than likely the case here. I wish that wasn't the case because this actually sounds someone like who could be of decent background in education to take this role if they were actually going to be acting independently. But that's not going to be the case. Calling it now. Anyways, let me know your thoughts in the comment section, and I will see you in the next one. If you made it to this point in the video, I just want to give a special thank you. If you enjoyed it, please hit that like button down below. And if you really enjoyed it, maybe consider hitting that subscribe button while you're down there. I want to hear your thoughts in the comment section. I will try to reply to any and all comments that I can. Until next time, watch that video on screen.